Susan, thank you so much for coming through. I think I've been looking forward to this. I think it's absolutely fantastic. And these conversations and interactions are needed. And this is why I wanted to do something like this. And I think your personality, your energy, you have this energy about you, which I think is very, very contagious. So thank you so much for coming through.
It's an absolute pleasure. Thank you for the invitation and an opportunity just also to have a conversation that different practitioners can work together, that we find that there are places that we can meet and support each other on behalf of the patient or the client so that their whole well-being is cared for.
Yes.
And I think we all have a niche or a segment that we work with, and the human being is not just a segment. We are a whole being, as you've mentioned already. And to find the places where we can all work together to do that it's cool. I get excited about that.
I can tell. And I think that's exactly where I would love to start the conversation, which is, the biggest misconception of what a chiropractor does versus what you guys actually do. And I had the beautiful experience of experiencing the way that you treat, and I do realize that every chiropractor has their own way of treating.
Sure.
And so I think the first question would be, what would you say is the biggest misconception of what a chiropractor does versus what you do in terms of patient care?
I kind of wanted to throw that question at you because you're out of the profession.
Yes,
right?
yes.
So I'm biased. I know what I do, and I'm very fortunate that I draw to me the people that are like-minded. Perhaps that chiropractic is limited just to the physical body, that it's limited just to alignment, that it's limited just to pain and pain management. And these are all effects of what is something that is a little deeper, and perhaps the indicators that there is something that's not working in the system the way that it should do. So,
Yeah.
I mean, one of the first questions that I ask my patients is, what is the system that controls and coordinates everything in your body? And the wrestling that people have with this question is quite interesting, and they come in with their, you're going to the chiropractor's asking you this question, so they go spine. The children are fabulous. They all go heart. Your heart controls everything. And I can't dispute that on a certain level. But it is a question. So what is the system that controls and coordinates everything in your body?
That's the nervous system.
Yeah. And the spine is important because it is the protection for that nervous system. Your brain sits within the cranium, and then that spinal cord, which is your information superhighway, if you will, is traveling down your spine. So if your spine is not functional, definitely that's going to create interference that affects how the nervous system, with all its nerves connecting to every cell of your body. And when that interference happens, the connection doesn't.
Yeah.
So we go from a place of function to a place of dysfunction, and a place of ease to a place of dis-ease. And that progresses. If you're in a state of dis-ease for a long enough period of time, you can see where I'm going with this, we suffer from disease processes. And when you're already in a place of disease, it's a long journey up a mountain to get to a place of wellness. So that perhaps is that connection, that it's not just about pain, it's about your whole body wellness. Can you get to a place of ease? Can you get to a place of full function? And chiropractic just loves working with that.
And I think, as a health practitioner, I think we're all trying to do something to that effect. We use different mediums. As a biokineticist, I use the medium of exercise. You use the medium of manipulation. And physiotherapists use the medium not only with exercise, but they also use manual muscle releases and, you know, whatever it is, but we're all trying to do the same thing to some degree. And I think the reason why I wanted to have this conversation is to show people that a chiropractor, a bio, a physio, the goal is the same. And so why is it then that we have to sort of go against one another and belittle one another? Because that is, in my experience,
happens far too often.
That has been my experience. And so I feel as if when we realize that the goal is the same, and yes, my way of treating will be different to your way of treating.
And needs to be.
Yes. And explain why that is the case.
Because my approach is limited to, like I said, my niche, my segment. I know about this stuff. This is my expertise. And I'm really, really, really good at that stuff. But if you ask me what are the exercises that I should be doing to rehabilitate, so there's a whole process. We can talk about the journey of what a person goes through to get to a point of wellness. But my expertise is here. So then I need support. I need somebody whose expertise is these are the correct exercises. And the effect of that nervous system disruption is a certain misalignment. So if that misalignment can be corrected with specific exercises, which is what you know about, or specific muscle releases and soft tissue work, which is what the physio knows about, then I can do my work on the nervous system. I can correct the patterns that are going on in your brain and make sure that you are optimizing that. And I can send my patient to get the correct exercises or to get the correct soft tissue work that will enable that nervous system now to integrate everything and work optimally so that it's functioning optimally. But it needs help. I'm not trained to do all the soft tissue work. I don't have the time to do the soft tissue work. I did learn dry needling. I am needle phobic and will not do it, but it's an incredibly effective therapy. So go to somebody who knows it. I understand exercise. I trained in exercise stuff when I was studying because I was so interested in it. I can give you a very effective, in those days, aerobics class. I can exercise your body. I understand how it works. But the biokineticist fine-tunes that. I mean, that's my experience with you. I have a pelvis that is slightly stuck on one side. The fact that I can just work on that side very specifically and correct that, I get the adjustment, corrects the neurology, you give me the exercise, which helps train the muscle back to fully functioning muscle. Because I've trained the brain, it's not going to recur. The problem is now resolved. And because I've trained the muscle, it's not going to recur. So we need each other. We have to work together. And I mean, you said the goal is the same. And perhaps I'm going to tweak that a little bit. The person who sits in the middle is the patient or the client. What is their ultimate goal? Because sometimes what happens is we put our goal. I mean, I want everybody to be 100% well, focused on optimum health. You know, we can talk about the health continuum as well.
Yes,
but
yes.
Sometimes their goal is just get me out of pain.
Yeah.
And for me, that's the first step on your journey.
Yeah.
You then need to correct the issue. I need help, biokineticist, please. We need to stabilize. What are the lifestyle issues that we are engaging in which are causing the problem in the first place? If we don't link that together, we're not going to get to a point of wellness. And if we don't see how those lifestyle issues are affecting things other than just physical pain is a wonderful, wow, something's wrong.
Yes, it's a sign.
But it's a sign. So is bad sleep. So is sinus issues. So is digestive issues. These are all signs that, from the chiropractic point of view, that your nervous system is not working.
Yeah.
Because your nervous system supplies all of those things. Can we remove that interference so that you can think clearer, so that you can breathe better, so that you can digest your food and absorb all that nutrition? People go and change their diets, but their gut is so grumpy,
Yeah.
they're not absorbing anything anyway.
Yeah.
You need to work on all of those things. And I mean, if your focus is get out of pain, you're not seeing that picture.
Yeah.
So there's this, which is the most important thing in my life right now. And unless you ask the question to your patient, but what is this impacting? If you get out of pain, what is this going to enable you to do? How is your life going to be better? You know, I can't pick up my grandkids.
Yeah.
I'm training for a particular sporting event. I just want to be able to think clearer. I'm suffering from brain fog all the time.
Yeah.
What are they coming in with? Neck pain, headaches, low back pain. But their quality of life has been affected by it. So if we can connect those, we will get people to understand that there's a much bigger
That's
picture.
it. And I think that's the whole idea behind it, is that when it comes to pain, particularly chronic pain that doesn't involve any accidents, incidents, something that, you know, you sort of just notice, my neck is tight, or this is there, and there's no real incident. And sometimes an incident can occur, but what I'm trying to say is we have to also get to a point where we have to educate our clients, patients, to understand what pain truly is. I have a beautiful acronym for pain, and it goes, pay attention inward now.
I like that.
Pay
attention.
Inward now.
That, I think I should put that up. Because that's it. We look for the quick fix. So if pain is an alarm system that's going off, I've got a friend. She's a really, really bad cook. Really. I have been given permission to relate the story, the lasagna story. So she invited some friends around, and she decided she was going to cook a lasagna. She followed the recipe, stuck it in the oven. And of course, everybody comes in, and they're having drinks, etc. And this is in the UK, so they've got smoke alarms flipping everywhere, and the smoke alarm goes off. And of course, she dashes into the kitchen. There's smoke billowing out of the oven, which is not her priority at all. There's a smoke alarm going off.
Yeah.
This is your pain warning signal. She hops onto a chair, disconnects the batteries out of the thing, the noise goes off, and she goes, problem solved. And this is what we do with pain.
Yeah.
We give it a quick disconnect from it, but the reason the smoke alarm is going off is that the lasagna is still burning in the oven.
Correct.
Can we identify the burning lasagna and sort that out?
Absolutely. Sure.
Then we can resolve more things. So pain is just a warning sign.
Absolutely.
You've got to go and find out what's setting the alarm off.
Exactly.
And it's often not in the same place. I mean, the lasagna is in the oven. It's not in the smoke alarm, right? The smoke alarm is not the problem.
Exactly. And most of us, well, I don't want to generalize, but a lot of people look at the site of pain and not where the root cause may be coming from. And most times it's lifestyle, it's stress, and so forth. And to your point, I would love to just add and say that sometimes people aren't ready to look at the bigger picture of, okay, I need to look at my mental state, I have to look at my eating, my exercise regime, whatever it may be. Sometimes they just want to get out of pain, like you said.
Well, the thing is, can you even look at those things when you're in pain?
Exactly.
So that's why I said it's a journey. You have to clear the pain first. And in that process, you're dropping little hints, perhaps. So I speak about spinal hygiene. There's something that you should be doing every single day. What else should we be doing? But let's get you out of pain first. Because if you are out of pain, you have the physical capacity to start looking inward, to start looking at what else could be contributing to what's going on. And it can be a long time ago.
Yeah.
You know, this is not just, I bent over, was brushing my teeth, and my back went.
Yeah.
There's something that happened long before that led to the place where your body couldn't hold you while you're bending forward and brushing your teeth. That's the last straw, as it were.
Yeah.
You know, the camel analogy, right?
Yes.
you have to look at how many straws have you laid down before that has led to the point where something that you expect to be able to do every single day
Absolutely.
suddenly causes you an extreme amount of pain.
And so one of the questions, so I asked a few people on social media if they could speak to a chiropractor, what questions would they ask their chiropractor? And one of the questions that they asked is, when do I know to go to a chiropractor? What are the telltale signs? When do I need to go to a chiropractor?
So the
it's a tricky one.
No. Well, it isn't. It isn't. It depends from which point of view you're going to have a look at it. If you have a brain and nervous system and a spine, you need to go to your chiropractor.
So everyone needs to go.
Everyone needs to go. Do you have teeth? Do you go to the dentist?
Yes.
Do you have a nervous system? You need to go to your chiropractor. People leave it until they get some sort of indication. They want a reason to be going, because the medical profession only deals with symptoms. So I'm going to go back to the health continuum that I mentioned very briefly just now. So we have this continuum of, on one end, severe illness. I mean, the end point of that is death, right? And we travel along this continuum to a point of optimum health and wellness, which, if we're living optimally, could also end in death, but only because it's the end of your life, not because you've gone on this degenerative place. Halfway along this continuum is a place with no symptoms. And when I tell people this, they're horrified. Halfway along. So if you're suffering symptoms, you're on the wrong side of this continuum.
Yeah.
So symptoms is too late. You need to be checking, what is your function? How are you feeling? What is, your well-being? And we never pay attention to that. We kind of accept that that's just... So we don't do anything when we're feeling like that, because I'm well, right? I have no symptoms. So as soon as you have symptoms, you're now on the wrong side. And the question is, which way are you traveling? If you're going further down this continuum, the end is nigh. And it's a horrible journey.
Yeah.
I mean, we all know people that have been severely ill and their bodies have deteriorated, and what that looks like. If you can catch yourself and turn yourself around and head in the right direction, and the medical model is, you need symptoms before I'm going to treat you. And as soon as you've got no symptoms, I stop treating you. I mean, if you go to the doctor and say, I'm really well, but something's a little off.
Yeah.
I don't know what it is, they're going to look at you and go, what do I do with you?
Absolutely.
I don't have an assessment. I don't have a method of checking that your system is working.
Yeah.
But your nervous system gives you cues all the time. I mean, we did a little finger strength test,
yes,
right?
Yes.
And I mean, you're strong, you're active, you're healthy. And you couldn't hold your fingers together when I tested it. So here's a cue.
Could we do is there a self-test that you could do in order to...
That's a tricky one with that one.
Because I know in applied kinesiology, they would ask you to pull your finger apart.
Yes.
Is that something that...
You can absolutely try it. The thing is that the applied kinesiology is related to what you're thinking and feeling. So I can test, is the thought process you're going through positive or negative? If it's negative, that's going to split. So the state of being is also going to result in changes in the test.
With you.
So yes, you can use it, but then you have to be very clear about what you're asking. And that's where the body testing, whether you're using sort of weight forward and backwards or muscle testing with your fingers or that kind of thing, starts to get a little tricky.
Okay.
You need a certain objectivity, which is why it's easier when somebody else does it for you.
Okay.
So functionality, can you balance? Can you balance on one leg? Can you balance with your eyes closed? So a healthy nervous system can balance on one leg with the eyes closed for 10 seconds. After 35, we start deducting a second. Why? I don't know. There's no good reason for 35 being the cutoff. If your nervous system is functioning, you should be able to balance on one leg with your eyes closed for 10 seconds, whether you're 35 or 65.
Yeah.
There's no reason. Can you do that? Most people can't balance on one leg. I mean, you'll know this.
Yeah. Absolutely.
Long before their symptoms. Equally, both sides.
I love this because it really puts such a simple way of testing, and it gives you a pointer as to what exactly is happening internally via the nervous system. And I think that's something that anyone can do,
Yep.
you know, and testing out right and left and seeing which is more affected, and then realizing, okay, there's something in my system that is not firing well or not active enough. And I love your explanation of what a subluxation is, because I think it clearly defines how the nervous system operates, which is something that we can definitely chat about further down. But so just to sort of bring it all into so people understand, so everyone needs to go to see a chiropractor, like you would go for a dentist checkup. You should go. Don't wait for symptoms, and make sure that you have a regular appointment. How often should one see a chiropractor?
I think that depends on the rest of your lifestyle. So I talk about the scales analogy. So we are doing things in our daily lives that support our systems.
Yeah.
This is all your lifestyle stuff. You're sleeping well, you're eating a particular diet, you're exercising regularly, you're looking after your mental health, emotional health, spiritual health. And there's a whole bunch of stuff that we do every day that supports that.
Yeah.
On the other side of the scale is all the stuff that creates stress. And we look at 3 big areas of stress. So physically, are there accidents, falls and injuries? Are there repetitive postural stresses that you're engaging in every day that are impacting into the system? We look at toxicity or biochemical stress. What are you putting into your body? Does it serve you? And it's not only nutritional stuff that we're exposing ourselves to. What is everything that you're consuming? What are you looking at? What are you listening to? A lovely meme that I came across just a week ago was, if you could eat your thoughts, would they nourish you or poison you?
Sure.
So we're consuming that. What we are thinking comes into that. And that is the mental and emotional stress that we are potentially under. And it's the one time as a chiropractor I'm like, no balance. I want you to weigh heavily in the stuff that provides your system with support.
Yeah.
Because stress comes along unexpectedly. I mean, there is chronic stress, there's stuff that's going on every single day, and that just weighs gently down. But typically the big stresses are things that are big events. They're a moving house, that's a death in your family, it's divorce, these are big stresses.
Yeah.
And they hang on the scale like a big rock. Wow. And if you don't have enough resource on the other side, and then we feel the effects of that.
Yeah.
That very quickly takes you on that health continuum, way down the continuum. We get to a place of symptoms very, very quickly when we don't have the resources to help us manage and cope with our stress. So, yes. So
it's very client to patient specific.
Yes.
And so the biggest thing would be start the journey, make the appointment, go see a chiropractor. And more so I want you to speak about, because I've heard this so many times, Kaylin, I went to a chiropractor, but I didn't like the way they adjusted. I didn't like the way they treated. I just didn't feel comfortable. I felt like it didn't do anything for me. What do you say to that? Because I know that as there are many chiropractors, are there many different ways of treating clients or patients. And so you need to find the one that works for you.
Yes.
And so what do you say to people who had a bad experience?
It's a challenging thing to answer, because we do have our own unique styles, and there are different styles of techniques that help us adjust, I would prefer the word adjust rather than manipulate the spine, to correct that interference in the nervous system. And there's, again, it's a spectrum from very manual, vigorous, the ruk and pluk process of getting that joint to cavitate so that there's movement that's happening in the joint, which then creates the stimulation into the nervous system to correct that nervous system functioning, right through the whole spectrum to very low force techniques, which are incredibly gentle, which can be used on babies and pregnant moms and elderly with osteoporosis, because we need to have a spectrum of capacity. So when you study in South Africa, you learn a technique called diversified chiropractic. It is a manual technique. You learn how to manage the joint play. I think you do a lot of joint play work, and you can see where there is restriction happening at a joint level. And to then identify, is that the level that is creating the most impact into the nervous system? There are various techniques of analysis. So you've detected that there is interference. You want to analyze if that's the correct area to adjust, and then you can go in. And the techniques that you can then use fall on the spectrum. So perhaps to ask the chiropractor that you're approaching, do they use very manual techniques, or do they use more low force or neurologically based techniques? And from there you can start establishing whether that's going to be something that's more comfortable for you and not. I changed my technique because I also find manual adjusting to be an extreme intervention, and I would sometimes be sore after my adjustment. I was like, is this necessary? If it is, I'm willing to work with it because I feel better afterwards. But is it necessary? So my little journey of exploration led me to a technique called torque release technique. And it's a very gentle technique. It uses a tool called an integrator, which provides the click. Everybody gets a click, but it provides the impulse into the nervous system to reset the nervous system to correct that interference, which you mentioned the word subluxation earlier. That is interference into the nervous system. And if you can remove that interference, the flow between the brain and the body is reestablished, function is reestablished, ease is established, and that's what we're looking for. So perhaps you need to investigate your chiropractor.
Yes.
Ask them some questions. What kind of techniques do they work with? Do they work with children? Because they will have to modify their technique if they're working with children. They will know how to adjust gently if you're working with children. Or elderly people, do they have a large geriatric practice? You can't adjust a person that has osteoporosis in the same way that you would adjust a 20-year-old athlete. You can't do the same thing. So if they have that spectrum within their practices, they're more likely to be able to modify the technique to something that will be more comfortable for you in your experience.
And how do you know which technique would be ideal for you? Is there a way of knowing, or is it purely just experience? Going, getting manipulated or adjusted, and then sensing and feeling how that feels, and based on that, or is there another way that one can figure that out?
Yeah, it's going to be experience. It's also what appeals to you. So exercise, for example, you're going to have people that are cardiovascular junkies. They want to go for a run, they want to go for a cycle, they want to get that going. There are other people who look at you like you're very, very strange. The thought of running a marathon is insane, but they're happy to spend an hour in the gym lifting heavy weights, sweating, pumping, getting that experience. And there are other people that would look at that and go, there's no ways. There's absolutely no ways. I'm going to go and do my yoga, my Pilates. So we are individually leaning towards a certain exercise style, a certain way of moving our bodies. The same thing with the chiropractic adjustment is different styles are going to appeal to different people. And I do have crack addicts in my practice. They want that manual crack experience. And I've worked with them, and they understand that the nervous system is the priority, and if I correct the nervous system, they won't feel the need for a manual adjustment as much as my gentle technique, but there are those that still love it. They get an enormous sense of relief from it. It gives them a sense of satisfaction when their body, it feels like a release.
Yeah.
And if you work with a neurologically based technique, the release comes more internally. You've experienced it. Your breathing changes. You get this sense of ease, the muscles relax. I mean, I often can see that my patient looks like they would drip off the edges of the table. They're so relaxed. If they didn't have skin holding them together, they'd be jelly. So it's a different perception of that release in your body. And that different people have a sensitivity for that. And they desire that kind of release versus a more physical experience release. It's personal. It's a personal preference.
But I think it's exactly that. You brought the analogy of physical exercise and how people are more inclined to high intensity versus more cardio based, or more yoga or Pilates, more gentle. And it seems to be also personality. If you have a certain personality, type A personality, you like that high intensity sort of way, and then it seems like you more would be inclined to go for the manual manipulation. So there seems to be, and I've noticed that with my clients as well, people who are very much goal driven. We need to get the job done. They
want 10 exercises and they want lots of repetitions and they want to do it now.
Exactly.
Where there are others that are quite happy to do 2 exercises, work on it for a couple of weeks, perfect that, and then move on and do another couple of exercises and go through the process.
And the thing is, if you were to give the one who prefers that more gentle approach the high intensity exercises, it actually won't work.
Won't get the benefit.
They won't get the benefit of it.
No.
And so you have to pay attention to the client in terms of what they're more receptive to, and then meet them at that level and go from there, which I think is...
And that's where, if we work as practitioners together, we can also identify that and go, okay, at this point, you need to go and see the physio. Physio is going to get into those muscles, they're going to do all that work, they're going to release the tension that you're sitting with there, then come back and see me. I will work on the nervous system, we'll hold the work that they've done, and then I can send you to the biokineticist and they can get all the exercises right. And then you can identify whether we're going to give you 2 exercises to work on this week. I'm giving you a whole program and you've got to follow it and you've got to
Exactly. So, I think as human beings, we are multifaceted and there's so many dimensions to us. And I think you do a very good job at realizing and recognizing that. I had the beautiful experience of experiencing the way that you adjust, and I love your approach. What do you think is the biggest factor that people tend to overlook when it comes to their well-being?
Is there only one?
And there's usually not only one, but the one that pops up in your mind right now. Sleep. We
ignore sleep. We're very aware of diet as being a thing, of exercise being a thing, of even meditation and those kinds of things. There's a huge growing appreciation for how important that is. And we're sleep deprived. We do many things in our days that disrupt our sleep cycles, and our bodies heal and repair during sleep. So if you want to get better, you have to sleep well. And this is a personal wrestling, so perhaps I'm saying that out of my own biggest wrestling point. Is sleep. If you can manage to get your sleep well, you're going to be doing well. It enables you to have the capacity to tackle all of the other things, because the rest feels very overwhelming when you haven't enough sleep.
So let's go a bit deeper into that, because I do think that's such a big point. And the research has shown that sleeping is more important than dieting and exercise combined. So it's extremely important. What can people do? Because when you are sleeping, you go into this subconscious state. You don't know what you're doing. However, I do believe there are things that we're doing that deter us from getting a good night rest. So, very briefly, what are the things that we can do in order to get a good night rest?
So it comes back to hygiene. So we have dental hygiene. We spoke about going to the dentist. We've got an activity that we do every single day to look after our teeth. We have got things that we can do to look after our sleep hygiene. So once you're asleep, the quality of that sleep is determined by what's happened before. And that preparation happens an hour or even 2 hours before you're actually lying down in bed and trying to go to sleep. We don't consider the light factor around us. We expose ourselves to very bright lights, the blue light thing, and this disrupts the melatonin release in our bodies. Melatonin is the neurotransmitter that helps us go to sleep. And actually that process starts in the morning. So your exposure to morning light, as the sun is rising, that inclined light, exposure to your eyes helps set the circadian rhythm so that at the right point in the evening, your melatonin levels start to rise. And we disrupt that by exposure, and particularly to screens, unfortunately. So a rule is to stop looking at your screen for an hour before you go to sleep. If you can reduce the light, particularly overhead light, because your brain perceives overhead light as sunlight, and drop that light to below eye level so that you're receiving light from low. If you think in historic times, candle light or fire light would always have been at this level rather than overhead. You don't put candles up there, light a fire up there. This is something that we've used so that we can work. It's an amazing invention. Let's use it. But for the hour before you go to sleep, switch all the overhead lights off. Rather put a lamp on. Use the light at this level so that your brain goes, it's time to go to sleep. That the light has moved from the vertex down towards the horizon, and that then stimulates that circadian rhythm to going there.
Yeah.
Making sure it's dark in the room and cool. We overheat, and if our bodies are too hot, we're not going to sleep restfully. Would be a few points that I can think of offhand. I didn't research this before we started talking.
No, but I think you've covered most of the points. I think that's exactly it. Just be more mindful and realize. I think the biggest takeaway is knowing that your sleep hygiene actually starts the day before, or the morning rather. And so being more mindful of what are you doing throughout the day, how are you waking up, and and allowing yourself to be exposed to certain things and in the appropriate time. So for example, being exposed to the sunrise when the sun rises and not a phone screen or that or the other, making sure, like you said, that when you are sleeping, that all the lights are completely off, or it's pitch black. So absolutely, I agree 100%. Now,
have you got any sleep tips over and above those?
So I would say that there's one thing that I always share with my clients, and that is a bit of breath work before you go to bed.
Helping down regulate the system before you go to sleep. Beautiful.
Exactly. And I use a 4-7-8 count breathing technique. And so you inhale for 4 seconds, you hold for 7 seconds, and you exhale for 8 seconds. And the reason why we want to exhale for 8 is the exhale is linked to the parasympathetic nervous system. That is the nerve, that's the part that allows you to relax. And so by exhaling, that sigh is the game changer.
The release. And that's the release you get when you get adjusted.
Yes,
so
absolutely. And so that's something that I encourage. And I usually say, and the research has shown quite substantially, that it only takes 6 breaths to get you to that point. So there's no reason for you not to do it. And I actually messaged a client this morning, reminding him, so he has a bit of shoulder pain, and during the assessment we noticed that he is a chest breather. He breathes very much up into his upper lung.
So all these neck muscles and shoulder muscles are taking strain because with every breath he's engaging that.
Absolutely. And so I sent a message this morning and I said, please remember to breathe. And I explained what sort of breathing technique he would have to do. And I said it only takes 6 breaths. And he said, you know what, I just did it now. And my, oh my, what a difference it has made. And so it can have a tremendous impact if you're willing to give it a go. And I think that's the theme for today. Give chiropractic the go. Be willing. Experience it. Don't just take it by what we say.
Yes.
Actually get the experience and notice how it feels. And if you go to a chiropractor and you don't really feel that great, it doesn't mean that chiropractic as a whole doesn't work. It might mean that that person who's doing the adjustment might not be suited for you. And it doesn't mean that they're a terrible chiropractor. It just means you have to go elsewhere. And I think that's
Stop
important.
running, go and do some Pilates.
Essentially. And listen, I have a lot of clients who struggle to understand that concept of, Caleb, but I am exercising. I am being active. And I'm like, yes, but you also have to be mindful of the type of activity that you're doing. And so there are certain types of activities that you have to be mindful of given the space that you're in, the healing phase that you're in. And so we have to recognize that and then prescribe according to that. And I think, the patient education part is so important because we can only, at the end of the day, when they leave our doors, they have to be well equipped, knowing, this is why I've been in pain because of this and that, linking those points, as you said, and that's when the penny drops, and that's when they're actually then more equipped and empowered to continue to heal.
They have tools.
Exactly.
They can use at appropriate times. You don't use a hammer when you need a screwdriver.
Exactly. So we equip them with those tools. And so I always say we are facilitators of healing. We don't do the healing. The body does the healing.
You have an innate capacity to heal yourself. Absolutely. That's a fundamental principle in chiropractic.
Absolutely.
Your body heals itself.
So, 2 more questions. I'm absolutely enjoying this, I must say. What do you think, what would you like people to know, given what we've discussed? If you could give people a takeaway, and people have noticed that we sit in this cushion, I think we might have to just speak on this quickly just so people understand and they know that we're not that weird.
This is very normal. Come to my practice, you sit on the cushion.
That's exactly what happened with me. You're like, please have a seat on the cushion. And I'm like, okay. And the minute I sat on the cushion, there was this tremendous sensory awareness around my pelvis. And so, as you would normally explain, this is part of spinal hygiene. By sitting on this cushion, you're actually forcing the body to move in directions that you wouldn't have otherwise. And so it's a wonderful technique. And I thought, because you're a chiropractor, be coming in and you're all about, the big thing that you've got me to focus on is spinal hygiene. I thought, why not sit in these bad boys? And I must say, as I'm sitting here, I've been oscillating side to side, back and forth, and I've been aware of certain things as we're speaking, which is quite interesting. But I digress. So what is the one thing that you would love people to take away from today as a chiropractor, holistically, whatever it may be? The one thing that you would love people to take away? I know.
I think from an intellectual point of view, there would be the awareness of your nervous system being the controlling system. That when the message is getting from your brain to your body, everything works. When there's interference, and we've spoken about stress, so whether it be physical stress, whether it be biochemical or toxins stress, whether it be mental and emotional stress, when we are under stress, we're going to interfere with that nervous system. So we need to be doing things to help manage that stress. And an adjustment, a chiropractor who understands that correlation is going to enable you to function better. You will cope better with your stress. It weighs on the side of the things that you're doing. So just the awareness that that then is not just a pain warning sign, but that any sign of dis-ease in your body, things are not working well, is an indication that your nervous system is not working.
Yeah.
And whether that be your digestive system has an irritable bowel, whether that is high blood pressure, whether that is sinus issues, brain fog, they're all indications that your nervous system is not working well.
Yeah.
So you don't need to be in pain to get these things sorted out.
Yeah.
You're probably going to take a medication if you've got sinus issues. Is there another way of dealing with that? Certainly I feel that there is. You can stimulate your body's natural capacity to heal itself. Why is it not healing itself? There's an interference in that process.
Yes.
If we remove that interference, yes.
Absolutely.
On a practical level, a tool, I mean, we've spoken about dentistry. Dentists have been amazing at teaching us to brush our teeth every single day. Why? There's nothing wrong with my teeth, they're beautiful. Yeah? But it prevents the things that could go wrong. What are you doing for your spine? How are you looking after the structure that protects your nervous system? What I consider the most important system in your body. We don't do anything. We don't move it the way that it needs to. We don't strengthen it the way that it needs to. We don't align it the way that it needs to.